Good morning and welcome to Southern Maine Health Care's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Health Care. My guest today is Nancy Bouffard, a registered occupational therapist and lymphedema specialist at SMHC. Nancy is with us to talk about lymphedema, which is something many of us might not be familiar with. Welcome to the show, Nancy.
Thank you. Thanks for having me.
We like to begin each show by talking about you and how you got into medicine. So tell us a little bit about yourself and how you got into occupational therapy.
Well, I guess it all started when my mom was diagnosed with breast cancer when I was 13 and unfortunately passed away when I was 17, which started my whole pathway into wanting to do some sort of cancer rehabilitation. So I'm a graduate from the University of New England with a specialty in cancer rehab, and continuing with my education after graduation, continued with certifications, and became a lymphedema therapist. Certified probably about 7 years ago, and I've been specializing that and cancer rehab ever since.
So we've heard that term occupational therapist many times, but what does an occupational therapist do?
Well, different settings have different types of occupational therapists, but our main focus is to get people to be as independent as possible in their daily functions. So a lot of people think that occupational therapy means getting them back to work, and that's not necessarily true in the sense of a job. We view occupation as the things we do on a daily basis. So that being getting yourself dressed in the morning, taking showers, meal prep, taking care of children. And that may also include what you do for work, but not for everybody. So we really break down people's daily performances and view those as occupations and try to get them as independent and functioning as possible with those tasks.
So what sort of conditions do you treat? What sort of things do you see on a daily basis?
Well, me specifically, I see mostly lymphedema patients. I also treat breast cancer patients for energy conservation, weakness and fatigue, a lot of axillary web syndrome, which is, a painful syndrome of the lymphatic system after cancer treatments, scar tissue massage, a lot of subsequent issues that arise after cancer treatments. But that's a specialty niche, and other occupational therapists might see anything from, cognitive therapies or carpal tunnel, epicondylitis, and I do some of those treatments as well, but my main focus is on breast cancer rehab and lymphedema specifically.
So an occupational therapist might see someone who has repetitive motion injuries. What about accident victims?
Absolutely. Trauma, wrist fractures, the list could go on. Essentially, any musculoskeletal, stroke patients who have lost function of their arms or mobility, safety, anything along that realm.
So it sounds like a lymphedema specialist is a specialty within an occupational therapist.
It is, and it's also, you see a lot of physical therapists doing it as well. I think it's a niche, and so for people who are, RNs can also be certified as well as massage therapists in lymphedema therapy. And I think that you'd really have to have a passion for that particular type of service because it is quite different than the other spectrum of therapies. What I do specifically, I also work with Dr. Scher in the wound clinic doing wound care, and we found that to be really beneficial for helping to promote faster wound closure when we're dealing with people who have wounds as well as swelling, and that can complicate healing. So that's not necessarily for everybody.
Now, for our listeners who aren't familiar, and for the layman out there, the lymphatic system, how do you explain it? It's so complicated. Can you give us a brief rundown of the lymphatic system?
Basically, what the lymphatic system's role is it's a system within our body that helps to transport fluids. A lot of white blood cells that helps to fight infection. I like to refer to it sometimes as the trash can of our body because it picks up a lot of our waste products and it filters things through. So when there's a disturbance to the lymphatic system, for example, if there's been trauma, if there's been surgery that has ruptured the vessels, or lymph nodes removed, whether they be from infection or because of cancer, then something that disrupts that system can hinder the way the body is able to drain fluids. So when we say someone has lymphedema, basically what that means is they have an accumulation of lymph fluid somewhere in the body. And that can be anywhere from the face, neck, anywhere, legs, arms. We see more arms specific for breast cancer patients. Lower extremity, the legs can be a variety of things, including cancer, but also from a problem with circulation, venous insufficiency, chronic wounds. The list could go on for different reasons, but basically when there's that disruption in that vessel, in those vessels, because it creates like a spider-like system throughout the body. Just as our circulatory system carries blood, these lymph vessels carry lymph. And so when that system has been interfered, let's use breast cancer patients, for example. When you've had a lumpectomy or a mastectomy, basically what's happened is you've gone in and surgery alone can impair those vessels. So all those little spider-like vessels that drain to the lymph nodes are cut through the incision. One step in interfering with flow. And then you go in and you remove part of the lymph nodes. And that can also result in a decrease in that flow. So imagine now the lymph nodes as like a shower drain, and you just remove part of that drain. So now the amount of fluid that can flow through that drain is even less. So the result of that being an accumulation of fluid. Lots of times we'll see it in the arm or sometimes only in the breast.
So to help us visualize, are there certain parts of the body where the lymph nodes are more gathered? Can you tell us a little bit more about that?
There are. Every individual is different. We have anywhere from 300 to 500 lymph nodes in our body. And so the only real way to be able to say how many someone has would be to go in and physically count, which we don't do, which also impacts the risk factors that someone may have. Someone who has maybe 25 lymph nodes in their underarm, in their armpit region, and only has 3 lymph nodes removed because of breast cancer may have a lesser risk of developing versus someone who's gone in and had a full axillary lymph node dissection and now has less remaining lymph nodes. So the body is sectioned off into what we call watersheds, and it basically goes between the body. It cuts them, right down the sternum and right across the just below the ribs, kind of like a window pane. And so there's a group of lymph nodes that are under each arm, and then a group of lymph nodes that are in each groin area on the left side and on the right side. And so the left side drains the left leg, the right side drains the right leg, and so on and so forth. We also have scattered lymph nodes around through our abdomen, our face and neck. But mostly each quadrant of the body drains to its specific lymph node site.
Now, again, for our listeners out there, on a day-to-day basis, if somebody is healthy, how can they know what's going on in their lymphatic system? Or can they? Sometimes everyone knows when they get a cold. Sometimes the lymph nodes in your neck get swollen. Are there other things to look for in that regard?
The lymphedema system the lymphatic system is actually kind of a system that goes under the radar. You don't really notice it unless there's a problem with it. And so what you would notice maybe is, like you said, if you have a cold and you feel that inflammation in the neck, sometimes you can actually feel lymph nodes if they've become inflamed. It feels like a little nodular, a little knot that you might feel just under the surface of the skin. And depending on the situation, some of those lymph nodes are deeper. And so unless there's a problem, you won't really notice it. What you may start to notice if you do have a problem with it would be heaviness, some swelling, maybe not observable swelling, but maybe you start to notice that your clothing is a little bit tighter on one arm or your sock is a little tighter on one foot. Jewelry doesn't fit maybe the same as it did before. Maybe you have a little bit more difficult time putting your rings on or your watch on. So those all might be signs of fluid fluctuations in the body. And sometimes it's more, people recognize it because they feel it first before they see it. So it wouldn't be uncommon for someone to go into their physician's office and say, geez, my arm is feeling a little bit off. It's feeling heavy. It's not painful, but it's just feeling, if it fatigues easily, it just feels different. And those might be the first signs that someone is starting to develop what we would call a stage 1 lymphedema, because there are phases. And so for someone who is at risk for lymphedema, we have what we call a latency stage. And so that would be someone who has using cancer, for example, who has just had cancer treatments. Maybe they've had a sentinel node. Maybe they've had some surgical procedure where they're, quote unquote, at risk for developing lymphedema, but they don't have any observable signs. And so that's that latency stage. Stage 1 would be a progression of where you start to notice that there is some swelling, but it fluctuates. Sometimes it's there, sometimes it's not. It spontaneously resolves on its own. Then you can progress to a stage 2 lymphedema, which would be the point where now that swelling doesn't spontaneously resolve anymore. It is more of a chronic condition, and elevation isn't really making a difference. There's nothing that you can do to alter the level of swelling in which you have. So that's that stage 2. And then it can also progress to a stage 3, which is where we'd see more of what we'd call in the lower extremities anyway, an elephantiasis, where you start to see the skin change texture, becomes more woody and rough feeling, more fibrotic, sometimes can develop into weeping of lymphatic fluid because, imagine now that your leg is or your arm is so inundated with fluid that eventually fluid's going to take the path of least resistance, and that may mean weeping out of the pores and starting to cause other skin problems, open wounds, cracking, things like that in the skin. That's what we would call a stage 3 lymphedema. Obviously, the earlier it's treated and caught, the better the rehab is for lymphedema.
So it sounds like you can get lymphedema through surgery. Can you also get lymphedema through, say, lifestyle choices?
You can, actually. One of the most controllable ways that people can help to reduce the risk of lymphedema is maintaining a healthy weight. I do see quite a few cases of morbid obesity-related lymphedema, and that's because the fat cells our body also produces a lot of waste products. And so earlier I had referred to the system as kind of the trash can of our body. Well, when those fat cells produce waste, that increases the demand and the production of lymph in the body. And so now it's as if the body were to be having more lymph than its vessels could possibly carry. So when we're born with a predetermined amount of lymph nodes. We don't develop more lymph nodes. They don't grow more. Damaged vessels can regenerate and reroute, but the amount of lymph nodes and the capacity of your body to be able to drain those fluids doesn't alter. And so when you do things that increase the amount of lymph production that your body has, you're putting your body at risk for being able to not tolerate that level of fluid in your body. And so lots of times what we'll see is for people who are overweight is very symmetrical, bilateral, meaning both legs involved, that are, excessive swelling. Outside of that, it's usually more, there's a variety of different things that can cause it. Some people are born with it, which is called a primary lymphedema, which means they were either born with insufficient lymph vessels or lymph nodes, or not enough lymph vessels or lymph nodes for their body's capacity. And so that's what we would call a primary lymphedema. A secondary lymphedema would be something that would be triggered or caused by something else. Something else has now damaged the lymphatic system. So again, we talked about surgical interventions. Another risk factor specifically for cancer patients is radiation therapy. So we talked about how surgery can kind of sever the lines to the drain. Radiation therapy then adds on additional trauma by then essentially burning or creating scar tissue amongst those lymph nodes and those lymph vessels, which are very superficial to the skin. So when people go through a course of radiation, they're usually going for several weeks, dose after dose of radiation. And that's unfortunately a treatment that not only affects the surface of the skin, but it's a through and through. So every system involved that is in that radiation field is impacted. And those lymphatic vessels are so fragile that they can also become damaged. So when we're looking at patients, we're looking at what their risk factors are. So how many lymph nodes have you had removed? What was the extent of your surgery? Did you have a lumpectomy versus a mastectomy? Because that will tell us how many vessels were damaged. Sentinel node biopsies are certainly helpful in helping to reduce the risk factors for lymphedema, but that doesn't necessarily mean that it doesn't occur, because I do see a lot of folks who've come in that have had a lumpectomy and a sentinel node, and they still have lymphedema. So it's quite an interesting field, because there's no rhyme or reason as to who might get it and who might not. Lymphedema is still very early on in its research, and there's a lot of good research going on to see if there's people who are maybe predisposed, or what causes one person to get lymphedema and another person not to get lymphedema when maybe their treatments were exactly the same. So that raises a lot of question about, is there a genetic component or is there not?
You're listening to Southern Maine Health Care's Medically Speaking with Robert Erickson. My guest today is Nancy Bouffard, a registered occupational therapist and lymphedema specialist at SMHC, and we'll be right back after this brief message.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Health Care offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Health Care, a member of Maine Health.
And we're back with my guest, Nancy Bouffard from SMHC. Now, you've described the lymphatic system as kind of a drainage system or an irrigation system. Does everyone have the same lymphatic system? Are there differences between people, between men and women, for instance?
The system is set up the same for the most part. But again, for people who have been born with what we call, again, that primary lymphedema, that may result in significantly less. Their lymphatic system might not be set up the same way in the sense that it's deficient, but that wouldn't be considered normal. But again, the number of lymph nodes that people have vary, and it doesn't depend on height, weight, size. It's just kind of, you get what you get. Taller people, shorter people, that really doesn't impact the number of lymph nodes that you would have. It's just a set standard that varies.
So as a professional, you may be dealing with a system that's different for everybody. Is that fair to say?
Absolutely, which sometimes can make it difficult to, discuss with people, the risk factors for lymphedema, because it's unfortunately, treatments are so black and white, but the system itself is so gray, because when they come in, we go over the whole lymphatic system and risk factors, and I can say, well, I can't say that you're going to get lymphedema. I can't say that you're not. Sometimes people think, well, I had surgery, let's say 6 months ago, and I haven't had any problems with swelling, so I'm in the clear. Unfortunately, that's not the case. It's a lifelong risk factor. So when people come in more for education and risk reduction, prior to there being an onset of swelling, it's my job to educate them that those risk factors are, in fact, still there. So imagine it as a sub pump, I guess, that you may have in your basement, and it's pumping fluid, it's pumping fluid, it's pumping fluid. However, if it's been impaired or there's been damage to it, eventually, just as every other system in our body as we age, it can start to slow down. And when it gets bogged down with either too much fluid or it starts to become overworked, that pump will stop. It will eventually, slow down to the point where it's not being efficient anymore, and your basement will flood. So the same type of thing will happen with the lymphatic system, is that if that pump starts to become impaired over time, that might not be within the first few weeks after radiation or surgery or for whatever else the reason for the onset may be. The risk factors remain. And so those risk factors are usually highest within the first 18 months to 5 years after cancer treatments. But they don't go away after that. They're always evident. And so we teach risk reduction techniques, being, good skincare, good hygiene, weight control, healthy weight management, whether or not that includes the use of compression sleeves, gauntlets, compression stockings for risk reduction to help to reduce the amount of fluid that the body can send to that limb or area, as well as exercise, air travel, all of those things. All of those can play a role in whether or not someone can speed along the progression of a onset of lymphedema that, usually would be inevitable if it's going to happen.
So maybe walk us through a typical situation where a patient might come in and you have to treat them for lymphedema. Walk us through that process.
So at this time, there isn't a cure for lymphedema, but there is treatment and management for lymphedema. So that's why risk reduction is so important. If you can reduce the risk of it happening to begin with, that's ideal. But once someone has already kind of crossed into that phase 2 or even stage 1, stage 2 lymphedema, where we're actively doing treatment. And that treatment is called decongestive therapy, complete decongestive therapy. And that is composed of lymphatic massage, which is a specific massage that helps to kind of reroute that fluid that's accumulated wherever, that swelling in the body may be. So let's, again, use a breast cancer patient, for example, who has had a right-sided mastectomy. We want to drain that fluid from the whole right quadrant. So now we're talking arm, breast, upper trunk, back, on that whole right side, and drain that lymph fluid to the neighboring lymph nodes, being the alternate armpit area, using those lymph nodes to kind of pick up the slack, as well as the lymph nodes that are down on the same side groin, so on the right groin. So we would use special massage techniques to help to facilitate that lymph movement out of the arm and out of that upper quadrant. That's typically coupled with compression bandaging, and of course depending on the severity of swelling. So for someone who comes in and they have what we consider clinically significant would be a 2 centimeter discrepancy between one arm and the other, would be a clinically significant finding. And so that may warrant compression bandaging. And so the compression bandage is what's designed to keep that fluid from coming back into the arm. Because there's nothing else that we can do to stop the natural flow of fluids in the body, that quadrant is just deficient. And so the bandage then helps to keep the fluid out of the arm that we've just massaged out. So people come to treatment anywhere from 2 to 3 times a week to 5 times a week, depending on the severity of swelling, so that we can massage, bandage. Then they go home, we give them exercises that they do while they have their bandage on to help to accelerate lymph flow. And they come back, I take the bandage off, we massage, push more fluid out, and rebandage. And so that bandage is something that stays on 24/7. So it's a big commitment to have that on. It's awkward, it's bulky, but it is the gold standard right now as far as treatment goes and management goes for lymphedema. So the goal being that each time the person comes to therapy, that we're getting less and less swelling in the arm, and the girth of that limb is going down. Finally, when we get to a point with our measurements that we see that we've reached a baseline, we're not getting any more swelling out of the limb, it would be at that point that we would transition that person over to a long-term compression garment. And that's where that kind of phase 2 of therapy comes into point. Phase 1 being active treatment in clinic, and phase 2 being that self-management phase where now we're getting ready to discharge the person from therapy, but we need to give them everything that they can do to help to maintain what we've just achieved. So wearing compression garments long term to help to reduce that influx of fluid into the limb again. Because again, if they stop wearing compression, then the likelihood of that limb swelling again is very high. So that's that long-term management phase where that compression garment becomes critical to managing and reducing as much swelling as possible, which is more functional. It's more comfortable when you have less swelling in the arm, more functional, as well as it decreases your risk for infection, because people with lymphedema are at an increased risk for infection just by the nature that they have an accumulation of fluid under the skin. And if there's an introduction of bacteria to that fluid, whether that be from getting your nails done and having them not use proper clean tools, or, a nick, a cut, a scratch, a bite from a cat or a dog, anything that will introduce bacteria into that area will put you at an increased risk for cellulitis and infection of the tissue. And so, which can be quite dangerous and would require immediate attention from their medical provider and antibiotics to reduce that.
So if you have lymphedema, are there things that you can do to ensure a healthy body?
Well, again, one being that maintaining a healthy weight is critical, because that, if you're predisposed, if you're not having lymphedema that's a direct result of obesity, then maintaining a healthy weight regardless is still important, because that can be adding on to the level of swelling in your body. And so if you're someone who specifically maybe has had a breast cancer intervention, you have lymphedema, reducing your weight if possible, appropriately, would be helpful in reducing the volume of lymph that your body is producing. Outside of that, maintaining an active lifestyle. Sometimes people with lymphedema sometimes think that their arm is now, they have to baby it. They don't want to use it, because while you do want to reduce the trauma that you induce into that arm, you still want to be active, and using compression garments while maintaining an active lifestyle is important, because that can really help to reduce the amount of accumulation of swelling in the arm. So we still want people to go out and live their life. This isn't something that should interfere with your quality of life, so you feel like you can't go out and participate in activities that you enjoy, because that's not the case. But being aware of the risk factors. So that also includes extreme temperatures, limiting the amount of time that you spend in either extreme heats, saunas, hot tubs. Those can all increase the accumulation of fluids. Air travel can also increase the accumulation of fluid, just as it does with anybody that, flies. That, for a healthy body, when you land off your airplane, your body's your swelling kind of just reabsorbs, and you go on your merry way and you collect your luggage and you're off and on your vacation. But for someone whose system is impacted, that change in air pressure when you're in the plane can allow for an accumulation of fluid in the arm or the leg or whatever body part we're talking about. But then the drainage is the part that's the problem. There's no problem with the body sending fluids there. It's the body's ability to drain it and get it out. And so wearing compression garments as a risk reduction during air travel, even if you don't have active lymphedema at that point or evident lymphedema, that risk reduction piece for air travel is critical, because that may be the situation in which the straw that broke the camel's back.
So do people with lymphedema have to watch how much fluid they take in?
Tricky question. Not in the sense of just, basic lymphedema. If we're talking about someone whose lymphedema is triggered by other conditions, so people with venous insufficiency or congestive heart failure, renal disease, where they're getting lower extremity swelling from other systemic problems, other areas of the body that are deficient, that are resulting in swelling. That can sometimes spiral into turning into lymphedema. And so, let's use venous insufficiency, for example. So that's basically when the body's veins in the legs are less able to return blood flow out of the leg. The pressure builds up in the leg, and the swelling starts to sit into the tissue space, and now it's that lymphatic system's job to drain that fluid out of the leg, pick up all that fluid that the circulatory system has just put in there. So if there's something that is causing swelling in that regard, whereas people may be put on fluid restrictions for renal disease, if their kidneys aren't able to handle as many fluids, then that may be more of a beneficial point where you start to limit the amount of fluids that you take. But bottom line is, for someone who just has lymphedema, it's not really a diet thing. It's not really limiting how many fluids you take. True lymphedema isn't going to respond with elevation. It's really the decongestive therapy with massage and compression that's going to be the most effective in maintaining and reducing that swelling, and obviously reducing the caloric intake versus, fluids. If you're drinking water versus Kool-Aid, then that makes a huge difference.
Well, this has all been great information. If people want to get more information about lymphedema and lymphedema care, where should they go?
The National Lymphedema Network has a website that has great resource for patients who either have active lymphedema or just want to know more about risk reduction. There's resources, there's research articles, there's information on treatment, and there's also a location there where you can find therapists in your area if you're looking for someone who is certified in treatment for lymphedema that can direct you. The American Cancer Society also has a spot on their website with information for risk reduction and identifying lymphedema.
Well, we've run out of time for this week. My guest today has been Nancy Bouffard, a registered occupational therapist and lymphedema specialist at SMHC. Nancy, thank you for sharing some time with us.
Thanks for having me.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities. Brought to you exclusively by Southern Maine Health Care, your trusted resource for healthcare in Southern Maine.